Here at Health Innovation Manchester we have a really clear vision, and that is to use innovation to improve the lives, the care of the people in Greater Manchester. Not only their care, but to boost the economy within Greater Manchester.
We've got a very large, diverse population of people, around 3.2 million people. And within that population, we've got 10% of people living with chronic kidney disease. So the CKD project is part of the Health Innovation Accelerator. And what we wanted to do was map out the care pathway for those patients, because I think it's fair to say we had an understanding of that care pathway, but not a deep understanding. And by working with the system and with the industry experts and also academia, we wanted to bring everyone together to try and work out a really deep understanding of that chronic kidney disease pathway so we could better the lives of patients in Greater Manchester.
Myself and some clinical colleagues mapped that pathway as we understood it to be, and we overlaid that with the current evidence base for general practice when they should refer patients, what kind of tests they should be having, how they might identify patients at risk of chronic kidney disease. We then built on that piece of work with our colleagues at Boehringer and the care labs to develop that further through a series of workshops with health professionals from across the system in Greater Manchester and from a range of clinical backgrounds, to really understand the nuts and bolts of the pathway for chronic kidney disease as they find it day to day.
I work in secondary care, so I work in a hospital-based environment where we see a lot of patients with advanced kidney disease and needing to start dialysis and have kidney transplants. And with new management strategies, new medications and new treatments available for chronic kidney disease, what we really need to do is make sure the patients are correctly identified and who are eligible for these treatments, that they're started on these treatments and that these treatments are maintained throughout their life.
And throughout this project we have involved patients from the start and people living with chronic kidney disease, so that we're able to actually get a much deeper understanding of what the barriers they face.
I think it would be very interesting to get patients and professionals in the same room. So it was said that a lot of the things we were saying aligned. So if they did align, let's bring them together, Avengers assemble, and let's see if we can crack this.
Developing trusting, meaningful partnerships with our industry partners is absolutely integral to the vision that Health Innovation Manchester has. What do Boehringer bring? They bring a wealth of resource and expertise in their own area of chronic kidney disease. So we've lent really heavily on some of their clinical expertise, some of their resources, using external providers who are experts in their own area, people like the care lab. So they're able to power boost the things that we do.
There's been such a high energy of engagement. There's been a real drive and a need and an energy to be able to bring something positive to our system.
We've learned that the data that we have in our Greater Manchester Care record allows us to predict who may or may not have chronic kidney disease. So it's our absolute duty of care to get dashboards that flush those patients to the surface and give GPs an opportunity to have that earlier interaction.
One of the things that we're looking at doing is using our shared care record to help share some of that data and information, so patients aren't telling their story twice and they're not having to have repeated investigations at different points in their journey.
The programme has sort of come to an end with a bunch of recommendations about what we've observed in our understanding using the data, the qualitative, the quantitative, and that provides us with a really good evidence base to go back to system leaders, the people who commission services, who commission innovation into the Greater Manchester system, and say, here are a bunch of things that we know if you did something about would make a difference.
If we were able to just actually move with some of the recommendations, some of the opportunities that this discovery piece has presented and provided the evidence for, that would benefit significantly for the patients. If we could early diagnose them, if we could provide more carer support, if we could provide more mental health, if we could ensure that the clinical teams were connected much more cohesively and empowered to have the right knowledge, or empowered to have the right conversations and upskilled to have some of the specialist knowledge that they need to support the patients, then it's a no-brainer, isn't it?